Good morning, everyone. My name is Gabriel Bornoz. I'm the president of the Montgomery County Council, but here in my capacity as chair of our Health and Human Services Committee. Today we have a joint committee session with our Transportation and Environment Committee. I'm joined by my colleague and friend, Chairman Tom Hucker, and Councilmember Glass, who serves on both committees. Just a quick announcement that our colleague, Councilmember Rice, who's a member of the Health and Human Services Committee, will not be joining us this morning because he is our representative to the National Association of Counties that has their conference this week. But I know this is an issue very important to him, and his staff is tuning in, and he will follow up with any of the follow-up items. There are two items today for discussion. This is a briefing, not a formal work session. And it's first to talk about the Office of Legislative Oversight report on transportation barriers to medical appointments. This is a report that I had requested, but that many of my colleagues have been focusing on for quite some time. We know that the public health disparities, which have been exacerbated through the pandemic with really tragic and frankly immoral consequences, are issues that existed prior to the pandemic, but we have to absolutely make sure we address. And this report provides confirmation in many ways of some of the issues that are out there, but further justification for us to continue to focus on these important issues. So we will first discuss our OLO report, and then second, we will be discussing an update to the Transportation Service Improvement Fund, which I know Chairman Hucker has been very focused on, and we will be hearing from representatives from the administration, including Mr. Chris Conklin, our Director of the Department of Transportation, on where that fund stands. And OLO makes some specific recommendations with regards to how better all of us can access those funds, and we'll get into that too. So thank you all, and we are also joined by Councilmember Reamer, member of the Transportation and Environment Committee as well. So let's get started with the briefing on the OLO report, and I will turn it over to Ms. Stephanie Bryant to walk us through the great work that was done in this report. And then after her report, I will give my colleagues and I an opportunity to ask questions, and then we'll move on to the next item on the agenda, which connects very well to this report. So Ms. Bryant, I yield to you.
Thank you. I'm going to share my screen.
Actually, apologies, Chairman Hucker.
Yes.
Turning it over to you to make some opening comments as well, if you'd like to.
Not much to add, Mr. Chairman. Thank you. I'm glad we're doing this. I think I'm sure the HHS committee has continued to hear from the disabled community for, oh my gosh, how many years, that we have a lot of challenges in this space that we're not using our resources to address. I know the T&E committee, and I'm the only surviving member of the previous council, has had many frustrating meetings about this topic. So I'm really both grateful to Ms. Bryant for her terrific report that I hope will sort of unlock some action we haven't been able to see in the last 6 or 7 years, and really looking forward to the discussion, because this is I feel like we're both failing our taxi drivers and failing our disabled community, and the solutions are pretty clear and right in front of us. So I'm really hoping this is the work session that's going to move this troublesome issue forward. Thank you so much.
Thank you, Chairman Hucker. Ms. Bryant, turn it over to you.
Thank you. I will share my screen. Can everyone see the presentation? Good. All right. So good morning. My name is Stephanie Bryant with the Office of Legislative Oversight. I appreciate this opportunity to brief the T&E and HHS committees on OLO Report 2021-11. I appreciate the cooperation and assistance received from the executive branch staff and community stakeholders. Council requested this report to better understand existing medical transportation programs, county populations at risk for experiencing transportation barriers, and programs offered in other jurisdictions. To respond to Council's request, OLO conducted stakeholder interviews with executive branch staff, care providers, and nonprofit organizations. OLO also conducted a literature review of it and analyzed county-level data to identify populations at risk for experiencing barriers, as well as current programs in the county and service gaps. And finally, OLO conducted case studies of other programs in other jurisdictions that serve similar at-risk populations to those identified in Montgomery County. Today's presentation has 5 parts. First, an overview of medical transportation. Second, a discussion of populations at risk for experiencing transportation barriers in the county. Third, current transportation programs in the county. Fourth, a discussion of the Transportation Services Improvement Fund. And fifth, OLO recommendations. First, an overview of medical transportation. Transportation is necessary to receive ongoing medical care, particularly for patients living with chronic illnesses that require regular physician appointments and medication access. Examples of transportation barriers include lack of vehicle access, inadequate transit options and high fares, and distance and travel time to providers. For patients, transportation barriers lead to missed appointments and interrupted care, and for providers, missed appointments reduce clinical efficiency and revenue. Governments, nonprofits, and volunteer organizations provide rides to increase access to medical appointments. OLO found there are two broad types of transportation programs. First, Medicaid non-emergency medical transportation, which is required by law to ensure transportation to and from approved medical providers for Medicaid beneficiaries with no other transportation options. And second, patient-centered transportation is all other transportation operated and funded by governments, medical centers, or nonprofits, and includes diverse service options, including personal vehicles, taxis, on-demand rides, and public transit. OLO reviewed 8 programs in California, Florida, Massachusetts, Maryland, New York, and Ohio. OLO selected programs that targeted at-risk populations or filled service gaps like those in Montgomery County, which I will speak to shortly. Key program design elements. First, program operators use data to target, design, and measure performance of programs. Programs were designed to narrowly target the needs of specific populations, including identifying travel patterns and existing service gaps. Transportation options varied depending on patient needs. Programs served the lifespan of the individual, meaning transportation was provided to residents ranging from children to working age adults or adults with children and seniors. And most programs expanded transportation options to non-medical destinations, including disease management classes, job sites, educational activities, and exercise classes. Examples of service options OLO found when conducting the case study research is first, reduced or no-cost bus passes, served the lifespan of the individual, including young families and working age adults. Also, several programs in Florida incorporated on-demand rides for unexpected trips or travel to and from work when bus service stopped late at night. Second, to reach rural residents where there is extended distance to medical centers, disease management classes, and grocery stores or pharmacies, programs in upstate New York, California, and Maryland provide dedicated shared ride service, first mile, last mile volunteer driving programs to bus stops, or care providers were able to schedule on-demand trips, including for those without smartphone access. And finally, for patients with chronic disease or routine health appointments like dialysis or prenatal appointments, providers and companies are implementing on-demand rides and apps to increase the ability of patients to attend appointments, reduce late arrivals, and cover service gaps created by long transit rides or ride cancellations. Second, populations at risk for experiencing transportation barriers in Montgomery County. To determine populations at risk for experiencing transportation barriers to medical appointments, OLO reviewed national studies, interviewed county stakeholders, and analyzed census, health, and GIS data. 3 areas examined by the OLO report are demographics, vehicle access, and geography. First, demographic characteristics. Nationally, populations who experience transportation barriers to medical appointments are more likely to be older, of low income, less educated, female, and people of color. In Montgomery County, government and nonprofit stakeholders identified similar populations and expanded the populations at risk to include persons with limited English proficiency, children, persons experiencing homelessness, and persons living with chronic illness and disabilities. OLO reviewed county-level demographic and health data by race and ethnicity to understand the prevalence of vulnerable populations identified by county stakeholders. OLO collected data from the U.S. Census, Healthy Montgomery, and OLO Report 2019-7. On the screen are the data points OLO examined by race and ethnicity, including English proficiency, economic security, prenatal care, and chronic disease emergency department visits. In Montgomery County, OLO found that people of color have a higher percentage of residents more vulnerable to transportation barriers than white residents. For example, Black and Latinx residents have a higher percentage of population under the age of 18, with children more likely to live in poverty compared to white and Asian children. And Black and Latinx residents are more likely to have chronic health conditions, which require routine care, prescription access, and often emergency care. These conditions lead to higher morbidity rates. Turning to vehicle access, which means access to a personal or shared vehicle. Nationally, patients who walk or use public transit are less likely to establish medical care and more likely to miss appointments. To examine this on the county level, OLO reviewed U.S. Census data for zero-vehicle households in Montgomery County, as well as ride-on customer data. 7% of households in the county do not have access to a vehicle. These households are more likely to be people of color, with low incomes, and non-English speaking. Also, as shown on the right side of the screen, the data mirrors the characteristics of the ride-on users. Next, geography. One way to review geographic barriers is through access to public transit. OLO reviewed federal and county level data, as well as collected insights from stakeholder interviews. On the right is a map that shows the distance from WMATA and ride-on transit stops. As shown, a little more than half the county is within 3/4 of a mile of a bus stop. However, geographic barriers impact most groups in Montgomery County from accessing convenient travel to medical centers, including accessing timely care when traveling across the county. For rural residents, limited availability of and long distance to medical providers are coupled with a lack of transportation options and high transit or taxi fare costs. And comparatively for urban residents, even though they may be a short distance from a provider, they may be unable to attend an appointment due to transit fare costs or difficulty walking. For example, stakeholders mentioned a nearly 20-minute walk between a care provider and the closest bus stop. Also, bus stop access, including safety, crosswalk times, and the accessibility of the stop, present further barriers. OLO also looked at geographic barriers from the standpoint of drive times. On the right is mapped 3- and 5-minute drive times from area hospitals using a personal vehicle. Hospitals serve as medical hubs, with doctors' offices often clustering around the hospitals. Nationally, research shows that public transit trips take about 1.9 times longer than accessing a private vehicle, with wait times often exceeding actual travel time. As shown, much of the county is outside the 3- to 5-minute drive times from the hospitals. For those that rely on transit, trip lengths and wait times are detrimental to accessing continued care. Current county medical transportation programs are designed to reduce transportation barriers for at-risk populations in Montgomery County. I'm going to provide a brief overview of program offerings, followed by OLO findings related to programs and transportation modes. OLO reviewed 14 programs operated by county government, the Washington Metropolitan Area Transit Authority, and nonprofit organizations. Additionally, OLO reviewed private transportation options available. OLO collected data on population served, fees, services offered, and service area. A list of the programs reviewed is on Circle 5 of the packet. Current program offerings target low-income older adults and adults with disabilities. Programs are income or geographically restricted, and government and nonprofit programs are provided at no cost or reduced cost. OLO found that residents who do not meet program eligibility criteria are left with few transportation options to access medical care. It is common for older adults and adults with disabilities to earn too much to qualify for available county programs, but not enough to pay for private transportation. As a result, nonprofit organizations and volunteers fill critical transportation gaps in the county. In looking to the future, a one-size-fits-all approach to transportation solutions will not meet the diverse needs of the county. Future programs should examine how to address the gap in services for the programs that serve the lifespan of the individual, including youth, young adults, adults with children, and working-age adults. Government and staff and stakeholders identified 3 modes of transportation used to access medical centers and appointments: bus service, taxis, and transportation network companies like Uber and Lyft. The following are challenges highlighted by users for each of the selected modes. For ride-on bus service, stakeholders reported extended trip lengths and a high number of transfers required to reach medical centers. There is no 24-hour bus service to reach destinations like the crisis center, and there's limited non-rush hour service, especially in rural areas. For taxis, stakeholders report hours-long wait time due to a limited number of drivers, a limited number of accessible taxis, and cost-prohibitive fares, particularly for rural residents. And regarding transportation network companies, stakeholders report access limitations for those without knowledge of technology, and also the banking requirements required to use an app, as well as limited availability of on-demand ride service in rural areas. One way the county can expand transportation options is through the use of the Transportation Services Improvement Fund. The fund imposes a 25-cent surcharge on each transportation network company trip that originates in the county. The goal of the fund is to expand transportation options for low-income, disabled, and older county residents. The fund currently supports reimbursements of costs to offset the purchase or retrofitting of accessible taxis and additional time necessary to provide accessible services. The fund also supports incentives for improving or expanding transportation options for low-income, disabled, and/or older adults. However, stakeholders interviewed by the OLO report that the fund is not being used to its fullest potential. OLO found that at report release, the fund balance totaled over $3.5 million. Stakeholders interviewed by OLO identified several opportunities to use the fund to meet the diverse transportation needs of the county, including expanding income eligibility for current programs, allowing the fund to be used by county service providers like the Crisis Center to provide bus tokens or gas cards, and permitting volunteer organizations to apply for funding to help cover the cost of purchasing accessible vehicles. Overall, OLO has two recommendations. First, council, along with the executive branch staff, should review the Transportation Services Improvement Fund and how to optimize the fund to close medical transportation gaps in the county. And second, to evaluate potential changes to programs and services that address transportation barriers to medical appointments. This could include examining the transit barriers as part of MCDOT's Ride On and Reimagine study, reviewing data for county social programs that provide transportation to ensure that demand is being met, and finally, leverage existing partnerships with hospitals and care providers to expand transportation to medical centers. Thank you, and this concludes the presentation, and I will turn the discussion back to the committee chairs.
Thank you so much, Ms. Bryant. Just I'm going to put a finer point on this and why this is so important. In addition to obviously helping those patients who we need to make sure have better access to medical care, and once again, as was pointed out by the report, are disproportionately impacting our more vulnerable populations, our Black and Brown community, our older community for people with disabilities. It's a huge issue for those families and those individuals. But what happens is if they wait too long and get more sick, then they're more likely to use our emergency rooms, which we've heard about in other briefings, are completely tapped out and overloaded. And when we wait for people to get especially sick, it draws down on insurance premiums, and it creates this cascading impact across the board in our overall public health. And as we've learned in the pandemic, someone's health in Wheaton matters very much to someone's health in Potomac, and vice versa. And so this connects us in so many different ways. So I really appreciate the recommendations, Ms. Bryant, and also just the analysis itself, because you can draw a straight line between this conversation and our overall public health as a community. So I did have just a couple of questions with regards to the report itself, and then I'll open it up to colleagues to see if they have questions too. And because this is so linked to our next discussion, I think we can transition seamlessly into the update on where we are with the TSIF fund. And I know we have representatives from the administration here. But have you found, Ms. Bryant, in your analysis that I know in meeting individually with taxi cab companies and some of these companies such as Lyft and Uber, that there actually is an interest in partnering with local jurisdictions and government entities to maybe expand services and reach, and that there may be opportunities to meet even closer to part of the way to help underwrite the cost for people to be able to access these really important medical appointments. In your analysis, have you found that to be true? Are there examples of other partnerships in place, maybe in other parts of the country, specifically with those rideshare companies?
Yes, definitely with the willingness to partnership. One of the case studies is based right here in Montgomery County, providing access through on-demand transportation with taxis to get patients to dialysis centers. Another one with regarding Uber and Lyft. At the beginning of the pandemic, I talked to Manna Food, and Lyft had partnered to provide free rides to food distribution sites with Lyft for, I think it was Lyft, not Uber, Lyft, to food distribution sites. I think the partnerships are there, the willingness is there, and the knowledge of, the need is definitely there. And there's definitely partnerships that other areas I've found around the country for both transportation network, on-demand transportation network companies, as well as taxis, to get people to the services. I think one caveat that came out through the research is definitely there is a lack of those service options in rural areas. For example, Manna Food gave the example that even though Lyft had provided tickets, free transportation to the distribution sites, the residents in Damascus weren't able to access that because there were no Lyft drivers out in that area. And also just with fares, but definitely there is a partnership and willingness to tackle these problems.
I appreciate that. And then, and Mr. Conklin, actually, if you could turn on your camera, this question is probably going to be best answered by you. And I want to give a lot of credit to Council Vice President Glass, who's been working diligently to make our Ride On program more accessible, more affordable to all of our residents, especially those most vulnerable, with, of course, full support from the council. But Mr. Conklin, as we devise our transportation routes, and you and I have had this conversation before, these are obviously challenging times with regards to operating budget challenges and staffing shortages among drivers. But can you speak a little bit about how you work into the equation as bus routes are determined, not just Monday through Friday rush hour traffic, but those zigzagging of, appointments to be able to get to medical appointments or to be able to go to the grocery store, or how, if you could just provide a little bit of context and background on how some of those decisions are made. And do you think there's an opportunity for us, especially in light of the public health challenges we've had through the pandemic, to think more intentionally about those routes around medical facilities?
Thank you for the question. And I think it's easier to answer the second question first, because the answer is yes. There's obviously opportunity for us to look at different metrics on which to plan these bus routes than have been used traditionally. There are really two elements of the ride-on system that's structured there today. There's one kind of longer distance line haul trips that largely are geared towards connecting communities to metro stations, and many of those, as you heard in the report, are places where there's peak hour service but not all day service. There's another element that's focused on coverage, and this is intended to allow residents throughout the county to make trips within the county. I think one of the things we've learned through the pandemic, and frankly it was one of the key decision-making criteria we had in March and April of 2020, was how do we serve these medical needs along with other critical needs like access to pharmacy, access to banking, and other critical community support needs. And the essential service plans that were used in the early days of the pandemic were nearly 100% focused on meeting people's needs for access to medicine, food, and other critical community functions. And coming out of the pandemic, as we've restored service, we have not restored the service in exactly the pattern that was there before, because we've seen the ridership is more geared towards trips within the county for essential employment and these essential services as people return to transit. And many of our choice riders who are making those long distance trips, people who had many other choices they could make in how they wanted to travel, we're not making these trips. So we focus the resources on making these critical connections, like to medical appointments, as you've described in the report and in your question. As we take on the assessment through the Ride On Reimagine study, which is now underway, I think some emphasis on the types of trips we really want to support, like these, in addition to other suggestions other council colleagues have raised, like access to recreation centers, libraries, and other community support facilities, are going to be a critical component of what the transit network for the future looks like. And we may be de-emphasizing to some extent, those connections to longer distance commute trips by metro, as those may be slower to recover. So very much appreciate your question. I would say it probably was not a focus of route planning at the outset of the ride-on system and through its development, but it clearly is in the era we're in today.
I appreciate that. And ridership is up just in buses in general, certainly across our region. So it just underscores more people are accessing, more people are becoming comfortable with that system. Dr. Brunetto, I know you're here as well representing the Department of Health and Human Services. And of course, Dr. Brunetto heads up our Aging and Disability Division. Dr. Brunetto, I know we've had conversations about this too. I know the report and the recommendations ring so true to HHS, who's been working on these issues. Do you know if there's been any further analysis or surveys from patients, from residents that are out there, maybe from the Primary Care Coalition or some of the providers we work with who have contracts with the county, on how deep a problem transportation access is? Do we have a sense from the patient? We know, as was noted, those shortages, generally speaking, but do we have any more specific information at the local level that you're aware of? And if we don't, do you think that we can put plans in place to secure that information? Because data is going to very much drive where we go from here.
Terrific. Thank you so very much for inviting us and for this very important conversation. So you may have heard that in partnership with the Department of Transportation, we did a survey of persons with disabilities and older adults as far as their use of taxi cabs. Obviously, people use taxi cab for multiple purposes, not just for medical appointment. And that was done recently in December 2021. So we have some information from that particular survey. In terms of reaching out to our partners in the community, before COVID began, we had regular conversation with representatives of all of our hospitals to discuss discharge issues, and obviously transportation to medical appointments is one of those items. Since COVID, regretfully, we have not had regular monthly meetings with our hospital partners, and we are looking forward to resume those meetings now that things have come down a bit and they are less stressed out with COVID-related activities. However, I think your suggestion is outstanding, and we can definitely work with groups such as the coalition to obtain more feedback about what they see, what they hear, and collect data. The Primary Care Coalition is a terrific partner, as you well know, and we also have our own contractors for transportation that we can definitely connect with. They meet on a quarterly basis, and they share information, so we can reach out to them that way. Also on our team, we have a quarterly meeting with an advisory group of users, both persons with disabilities and older adults. Their group is called Getting All Around Montgomery County. So we can reach out to this advisory group as well. Thank you.
Thank you. I think that would be great. And there's data out there, right? Our Villages program, we received a briefing on our Villages program late last year, and the numbers continue to increase in terms of demand. And the Villages is such an important initiative, connecting so many different people to different services, and having sort of an analysis of those options that are out there, I think would be great. And then connecting another dot as we conduct that analysis and as we have that data available, that allows us to better maximize and use telehealth and telemedicine to those areas where we fall short for whatever reason. You know, we can have a greater emphasis or help use that as an option for residents to minimize that transportation barrier. So I know that I believe we also have Dr. Rogers here from our public health team. And I know this is an issue in terms of equity and access that the public health team has been working on. But Dr. Rogers, just in closing on this part, at least from me, in this part of the section, and we'll see if my other colleagues have questions or thoughts or comments. What is your, I know you all have been working on this, and also on the other side, enhancing mobile medical practices so that people don't just have to get to appointments, but that we can get the appointments to people. That's an important part of this equation as well. But given transportation is such a basic and obvious and profoundly important issue and a barrier to accessing public health, any thoughts or reflections from your perspective on analysis, data sharing, or where you think we need to go from here?
Yes, thank you, Council Member President Albornoz, for the question. Yes, the department is currently in the midst of planning for the launch of a mobile medical unit that will be deployed throughout Montgomery County, where we can take HHS services directly to our most vulnerable populations. I would say one thing that stood out to me with respect to the report, as well as my engagement with OLO, is the need for coordinated resources for those who are low income. Not those specifically who have disabilities, but those who are low income adults. And so, for example, I think about our programs across our county funded programs that Public Health Services operates. For example, our Montgomery Cares program, our Care for Kids program, our dental clinic, as well as our maternity partnership program, where there's really a need for a transportation budget in order to assist our low-income residents with getting to medical appointments, as well as those personal activities of daily living. And so we have already, in collaboration with our Montgomery Cares Advisory Board, as well as the Commission on Health, we have made a recommendation to Montgomery County DOT to see how we can utilize some of the transportation services improvement funding in order to address that critical need within our low income residents. I think I will also echo your previous comment, President Albornoz, in need for more data based on the needs of our low income residents, working with our partners such as the Primary Care Coalition, as well as other key community stakeholders that Public Health Services engages with, in order to gather that information along with our colleagues across HHS. And so I guess I will just kind of close where I picked up, is that I just want to make sure that the focus also is brought to those who are low income within the county, those adults that have children, so they can get back and forth to grocery stores, get back and forth to the local Walmarts, Targets, etc., as well as the medical appointments that they so need.
I appreciate that. And the other, I think, thought that I just sort of had, it's not a, it's common sense, but I do think, with each of our county sponsored clinics, right, our health clinics, both that we manage directly, but that we also coordinate with our contracted organizations, I think it would be great to create a time and space for some of those folks to be at the table as discussions are being had on different routes, so that they can get information due TOT on where people are coming from that come to our health clinic in Silver Spring. And our dental clinic, people come from all around the county to that dental clinic, and better understanding that. I've been thinking about the concept of a circulator bus, particularly in those communities where are especially underserved. But for us to be able to do that effectively, we do need data to be able to launch something like that. So all of these things are connected, and it's sort of one of those conundrums, because this falls into so many different categories of county government. But I do think a task force or something more intentional would be warranted here, because especially in light of what's happened. So look forward to following up on some conversations about this and see where we can go from here. With that, I don't see that any of my colleagues have questions or comments, so I think it's Councilmember Reamer would like to speak, and then what we're going to do is, after Councilmember Reamer speaks and Councilmember Glass and Chairman Hucker, We're going to go to TSIF. But before we do that in transition, I'm actually going to turn to Chairman Hucker to see if he has any general comments or thoughts based on the overall report, some of the discussion we've had now, and then I'll yield to Councilmember Reamer, followed by Council Vice President Glass. And I see that we've been joined by Councilmember Rice as well. So Chairman Hucker.
Thank you, Mr. Chairman. Sorry, I think Councilmember Glass and I were raising our hands on Zoom here rather than texting you. So I feel your pain about the confused mixed messages here, having shared a lot of these under Zoom. I'm not sure how much we want to cover in this work session versus the next one on the TSIF, but I mean, I feel like we've had, probably, I've sat through, I don't know, a dozen work sessions on this since we set up the fund in T&E and then in full council. And I don't know if, I know Dr. Orland's here. The council, I remember the first year, well, why don't I postpone that question? The next one about the data. We collect a lot of data about all the folks who call into call and ride. We don't have data, I don't think, for folks that call private providers directly. But Director Conklin, we have data on how many of our disabled residents call and ride, how many times the call is answered, how many times the call is dropped, how many times they're promised to ride, and how long on the average they have to wait, correct?
I believe so. Sam Oji, who oversees these programs, is with us today. He can provide a response on that.
Thanks.
Yes, thank you, Council Member. We do receive data weekly, bi-weekly, monthly from the cab companies.
Right.
And this will be, number of trips provided. With regards to wait times, those are information we receive from our clients directly.
Right.
For the program, we do conduct surveys, but a lot of clients proactively reach out to us to say, I called for a trip, I wasn't picked up for 30 minutes. So we do have the data.
You're feeling me. I hear that all the time. So do you have the data to share with us?
With regards to how many people?
The number of calls, the average wait time, the number of people that were never picked up, etc.
Well, the number of people that were never picked up, we get that information when the client actually calls us to complain. So yes, we have a record of all complaints that we receive. The number of trips provided, we do have the data, weekly number of trips, monthly number of trips for call and ride for each trip that each of the cab companies provide for us. But the wait times information, we only get that when a client actually calls to say, I'm waiting for this cab driver, they never came. And then we reach out to the cab company and say, this client is waiting.
Sure.
How much longer will it be before you pick them up?
I'm not sure I remember that. Okay, so the time for the number of clients who call, when somebody calls my office and says I was waiting for a cab and was never picked up, that's greatly underreported, presumably because the data that you're getting only are the people who filed a complaint, knew there's a complaint process and went to the trouble of filing a complaint, not the ones who just weren't picked up and went home and were frustrated, or the ones who were frustrated enough to call my office but not file a complaint. Is that right?
Yes, and the ones that call your office, we always get the information from your staff. So those are documented as well because we do respond to those. We engage the cab companies for each and every one of these. We have a complaint resolution process. We always work to establish some corrective action for each and every complaint. The cab companies, do as much as they can to resolve this, but yes, it does persist.
Right. Mr. Oji, my staff are fantastic. I'm not sure they reach out to you every time we get a complaint in our office. Sometimes people say, it's okay, don't follow up, or it was the third time it happened, or whatever. And, so anyway, I wouldn't make that assumption necessarily. I see Mr. Mohebi's here and Mr. Cassian, Mr. Chairman. I know they have a lot of expertise. I'm not running the meeting, but I'm guessing they turned on their camera to comment on this.
Yeah, before we get specifically to the TSIF discussion, which is a really important one in data, let's wrap up just the reports generally, and unless Council Members Reamer and Vice President Glass have specific questions regarding TSIF, and then we'll clean that up. Yeah,
that's fine. Can I go back to Dr. Bernetto?
Yes, of course.
Thank you. Just on the previous topic, Dr. Bernetto mentioned, I didn't fully understand. Thank you so much for being here. I'd love to get your insight on this. You had regular meetings with the hospitals. You said something about they were suspended during COVID. When were they suspended, like starting in March 2020 when COVID started, and when did they resume?
Yes, exactly right. Yes, we used to have, again, before March 2020, we used to have monthly meeting with representatives of all of the hospitals.
Yeah.
And we also had participants from the villages. And regretfully, during COVID, we had to discontinue this. But right now, as you well know, and we are so thankful, things are way calmer, and I believe we can continue and get to reschedule those meetings.
So they were in-person meetings. Are they?
Yes, they were in-person meetings. But clearly, we can do that remotely. Yeah. Right.
They've resumed?
No, they have not resumed as yet. But now that things are calmed down, we would be clearly looking forward to resuming them.
You're looking forward to, okay, thank you. That's
Sure.
great. Are they just on this topic or on other topics as well?
The topic was discharge from hospitals, and you may recall that some time back, the Primary Care Coalition had a special grant that regretfully was discontinued to work with older adults, in particular low-income senior housing buildings, and to help them accessing healthcare, and also when they were at the hospital, to help them with their discharge plan. So because that grant was terminated, we felt it was very important for us to communicate on a regular basis with the hospitals about situations they had encountered related to discharge planning. And clearly, transportation to medical appointment is a key element of that.
Okay. Did you consider, have you been meeting with them virtually or not at all?
Not during COVID on this particular topic, no. Clearly, we have one-on-one discussion about a particular patient at the hospital. We do that continuously, regardless of COVID. But in terms of having this particular focus on a monthly basis, we have not done that during the COVID episode, no.
Okay. So you don't have monthly meetings with the hospitals now during COVID, but you're looking forward to resuming them?
Me personally, I do not. However, many of our public health colleagues have those meetings on an ongoing basis.
Okay, great. That's very helpful.
Yeah, and I see Dr. Rogers is shaking his head. Yes, clearly they do.
So yes, Councilmember Hucker, public health services, at least with respect to the programs that I am responsible for, we meet monthly with our hospital community health directors and leaders across all four of our hospital systems to discuss strategic collaboration. Right now, I can say we've been mostly talking about our community health needs assessment, which the county is in the midst of, but we have a meeting coming up in March, and I'll be sure to have a conversation around transportation access, begin to plant some of those seeds based on what we've discussed today.
Okay, that's really helpful. Thank you. Thanks, Mr. Chairman.
Thank you. Councilmember Reamer, followed by Council Vice President Glass.
Thanks. I think I can wait for the transportation fund portion of the conversation, so I will do that. Thank you.
No problem. Council Vice President Glass.
Very good. Well, good morning, everybody. Thank you for the presentation. And I want to thank Council President Albornoz for commissioning the OLO report. Really forward thinking back when it was originally commissioned, and timely for discussion now. And so I don't want to repeat many of the insightful thoughts and questions that he shared at the top of this conversation. But two things I do want to highlight. One, it was mentioned about Mana and partnering with Uber, to deliver food. Well, at the beginning of this pandemic, when so many of our social services agencies, like JCA and so many others that had contracts for transportation, for senior centers and for other individuals with developmental disabilities, their vans were sitting idle. And so I reached out to HHS. I know others had as well, and said, let's rethink these contracts. Let's cut some red tape. Let's use these services that are not doing much at that particular time, and let's get them to the people that need those services. And so I highlight that because as we continue evolving and coming out of this pandemic and rethinking the way that government can work, I think we need to think creatively and critically about some of the existing contracts and how they could be repurposed or reused, recognizing that so many of those smaller buses only operate during a short window in the day to pick people up, take them to one of our centers, public or private, nonprofit centers, and then take them home. And so there are hours upon hours when they're not in use. And so I think this is something that we can look at. And then the second thing I just want to also elevate is that back in November, the middle of November, I wrote a letter to the Department of Transportation. I had we were listening in on a conversation with residents in East County, and we had heard, my office had heard, that residents in East County were particularly upset and concerned because there was not adequate public transportation access to the Adventist White Oak Medical Center. And what my office did is write a letter to Director Conklin, specifically highlighting that problem. And I'll just share with you all what that problem is. There's only one bus route that stops at that hospital, and that's the Metro Bus R2. And it terminates near Plum Orchard Drive, but it doesn't connect to any of the residential areas north or west of it. And there are a number of Metrobus and ride-on lines also that serve the Colesville Road Route 29 corridor, but the closest one is the Z6, and it stops about half a mile away, maybe even a little more. And so that is exactly the problem that we're talking about here. And so I had written to Director Conklin to see what can be done to mitigate that, recognizing it is not only ride-on, but it is also Metro Bus as well. Mr. Conklin, I'm just curious what your thoughts on that problem, that concern that I shared with you might be, and if there's any resolution to it.
I don't think there's any resolution as we meet today. Clearly, that is a major new generator in that part of the county that demands more public transit access. As that facility was being developed, there was substantial work on working with Adventist Hospital to develop a shuttle service connecting their facility to the Tech Road flash station, which was opened around the same time. But I think as we assess the services in the East County, and you'll know that we are doing a joint assessment of WMATA and ride-on services, increasing the access to the White Oak Medical Center is going to be a feature of that work. But as we sit here today, our service has not increased since your correspondence to us, and we've been trying to maintain the services we're providing rather than being able to do more at the moment. So we will get to that as we start to take on the recommendations in the study. But I do remember your suggestion. I do agree with you that there's a need to increase the access there, but we have not been able to get more resources to that particular need at this time.
Okay, that is an example, a glaring example of what we're talking about now, right? And so we see the disconnect. Residents are sharing with us their concerns about it, and we need to figure out how to fix it. If we can't fix this one in a very transit dependent area in East County with a brand new medical facility, then then I have grave concerns about the ability to do that in other parts of the county. But the last question I'll ask before we move on, Director Conklin, as we rethink or take another look at the ride-on services and the routes, I don't know, can you share with us the metric points, the data points that are being looked at with respect to how anything should be rerouted? And hopefully this type of medical care access is one of those data points.
Yeah, we have not set performance metrics yet. That will be coming. I think the traditional ones have been focused on system productivity and utilization. I think those have their place, but I don't think those are going to be the primary determinants of how we're going to evaluate and reset these routes. And not all routes will change. There are some that are very effective and make strong connections. We had implemented a new service a couple years ago specifically to provide a better connection between Shady Grove Hospital and Shady Grove Metro Station and Shady Grove Adventist Hospital. And the performance by the traditional metrics wasn't that strong. So we're going to be looking at access to critical services as part of the service planning, which, that always plays a role, but it's played a secondary role to ridership, passengers per mile of service, passengers per hour, and those other productivity measures. So as we initiate the public engagement on this within this month, we are going to be asking our residents about the types of trips that are most important to them. Some of that is available from past surveys, but that will help us formulate the performance metrics. So we're not simply using the industry's standard performance metrics when we do this work.
Understood. I recognize that our public buses can't be all things to all people, and people need to go where they have to go. Last question. So you just teased out the process moving forward, and as it is integral to this conversation, what is the process moving forward for the bus lines for the new routes?
Absolutely. So we had published in, I believe it was November of last year, a draft scope of work for the Ride on Reimagined study and had that open for public comment for about 60 days. We received lots of comments, 150 or so suggestions on how to adjust that scope. They were very productive comments. So we went through the process to incorporate those suggestions into the scope of work. The consultant has been selected, the scope and fee for that has been settled, and we are now in the process of scheduling the first round of public engagement, which will occur in the second half of February, early March. The early work in this will be to assess the existing system, how well it's performing, how well it's meeting and not meeting needs, to hear from groups like the T&E committee, groups that use our services, outreach throughout the community, to understand from a broad set of perspectives what work and doesn't work about Ride-On. And then we will embark on identifying those types of performance metrics that we talked about that reflect the community's desires for the service, assess the current route structure, and again, it's WMATA routes in the county and Ride-On routes in the county. We're doing them together, how well those meet those. And then I imagine, we haven't got to this point yet, but I imagine we'll have a variety of scenarios about how the system could be structured differently to meet those needs and incorporate the planned implementation of new transit services like the Purple Line, like the proposed flash service on 355 and Beers Mill Road, and like the existing flash service on 29, and the ones that are currently in planning, so that we can redeploy resources as new things come online so that we're not duplicating. And we will also be working on the mix of services between the providers. So you're probably all aware right now there's not a balance of Ride-On versus Metrobus geographically across the county. And we may be assessing whether those systems can be structured differently so that there's a more even distribution of services rather than geographically concentrated distribution of services.
Well,
And one other element before we move on, because I think it's particularly relevant to this, we will be looking at the role that microtransit can serve more broadly than the pilots that we've had so far. So the Flex service, which now has call center scheduling and access when it resumes in March, to see whether that can provide a better role for not exactly origin to destination, but more accessible trips for people who might not be able to use the fixed route service quite as effectively due to disability or other issues that require them to get picked up closer to home.
Well, I like the way you just tied everything up in a nice bow, looking at the transformation project moving forward and allowing us to engage in that conversation about what metrics we look at, and then also the flex buses as well, which was a point that President Albornoz was mentioning and alluding to about having some of those smaller services in the area. So I appreciate that. Appreciate the continued conversation with DOT moving forward. And Mr. President, I yield back and appreciate you scheduling this conversation too.
Thank you, Council Vice President Glass. Chairman Hucker has a follow-up on this point.
Thank you, Mr. Chairman. Yeah, before we leave the topic of the OLO report and Ms. Bryant's great work, thanks, Councilmember Glass, for raising the topic of East County, which is greatly underserved. And yeah, please continue to coordinate with me and my office on your request to DOT, because I can guarantee you we have lots of unfulfilled requests to DOT to serve our East County residents better as their local council member, going back years. And that leads me to, well, I wanted to highlight your point. Yeah, you're right. If we can't get our needy residents to a hospital, it really makes me concerned about, who else we're not serving, because that seems like a core competency of a highly functioning county and one that our residents would count on. But I didn't want to lose the point. Ms. Bryant appropriately raises the concern of how well we're serving our rural residents. And this committee has, restored the right on route to Tobytown and a few other rural communities that had been dropped. And there's a very good reason for that, because we can't leave those residents out in the cold either, even if the route doesn't pay for itself. Since Councilmember Glass raised the issue of East County, I just want to point, not while we're talking about this topic of who's underserved, not leave out suburban residents in a place like Burtonsville that have been complaining every year I've been on the council. So that's 7.5 now, that they don't have the same service on the weekends that they do during the week, for example. And the same, these are folks who've been victimized by council decisions for years to redline their area, really all of East County, and to subject them to retail racism. So they count on ride-on to get to work, maybe in DC or even in Virginia every weekday. But then they also count on ride-on to take them to, they want to take their family to a movie theater. There's none in Burtonsville, right? They have to go to Silver Spring. If they want to go out to a nice restaurant, they might have to go to Silver Spring or Bethesda or Wheaton or somewhere. And so they count on the same ride-on service on the weekends, but they don't get it from us. They just have to wait, and they have to tell their kids, no, we can't go out because we're stuck in Burtonsville all weekend. And I get those complaints every month. They've kind of lowered their expectations at this point that we're actually ever going to serve them. But these are folks who have been, doubly or triply victimized by years of retail racism, and then more years of underservice by our transportation department, and it's still going on. So I just don't want to restore only routes to rural residents in the Ag Reserve or elsewhere who totally deserve it as well, and create a donut hole like we have in other social programs, Social Security and other things, where there's even more residents in a place like Burtonsville or White Oak that don't have the same level of service as we provide in a Bethesda or a Silver Spring. So that's frustrating to me. It's unnecessary. It's contrary to our racial equity and social justice commitment, but it continues. And I'm not really sure what we have to do besides just make different policy decisions and different investments in the upcoming operating budget to address that concern and make our reality meet our rhetoric. Thank you, Mr. Chairman.
Councilmember Hucker, I'm sure you know this, but most of that service in that part of the county is managed by WMATA, so we don't have the same level of direct control. That is one of the things we'll look to address in the Reimagine study to see if we can have more balanced service across the county by the two systems than we do today.
It is, Director Conklin, but it's served by WMATA by our choice. I mean, we could serve it by right on today, but we choose not to. We have buses going elsewhere and not to Burtonsville because we've chosen that. So WMATA's always had gaps, and they've had gaps as long as I've been alive. They're going to continue to have gaps. We fill in a lot of those gaps with Right On. We could fill in those today. We just have chosen not to. That's a policy decision. So I hear you, and I share your optimism about addressing them in the upcoming study. I want to work with you on that. Thank you.
Well, speaking of policy decisions, that segues into the next part of our discussion, which is TSIF. And as was noted in the OLO report, an important part of this equation and a really important opportunity that we've heard from a number of individuals is not being utilized to its full capacity. So Dr. Orland, thank you so much for joining us today. I know you've been staffing this issue for a number of years, and we appreciate your continued leadership on this. And I know we've had some recent conversations about this at the staff level. Before turning it over to you, I do want to just very quickly, we have Dr. Seth Morgan here representing our Commission for People with Disabilities. They are an amazing organization that has been discussing this issue and recently brought this to the attention once again to Chairman Hucker and I, which led to a very productive meeting with some of the folks who we will hear from in just a minute or two in our taxi cab industry. But Dr. Morgan, I'd love if you, as we, before turning it over to Dr. Orland to give us the specifics on where we are with the program, would like to hear from you and your perspective on why this issue is so important and why we need to get it right.
Well, I think it's critical, and thank you very much, Chairman Albornoz and Chairman Hucker for arranging this joint meeting. It's critical. There were previous comments made by Dr. Rogers about the importance of this program being used for people who are low income. I would point out that people with disabilities are amongst the lowest income because they're not able to get jobs frequently. So when you talk about low income, people with disabilities are at the very bottom of the barrel. So I don't think we need to expand on those issues particularly. I think this is critical, and if you would just bear with me for a moment, I'd like to give a little bit of perspective because I'm the person who has been around this for the longest, I believe. Many people have gone off of commissions and committees and council members over the years. This program, the TSIF, was originally set up at the request jointly of the Commission on Aging and the Commission on People with Disabilities. And the specific impetus for it was that because of the entry of Uber and Lyft into our county, the number of accessible taxis plummeted. We were going down and down. People who required accessible vehicles, and I would point out that anyone over age 65 already has 30% of those people have a disability, and it goes up exponentially from there. So the populations are the same, and we saw this dwindling of accessible taxi service. The taxi fleets had requirements of having a certain number of vehicles that were accessible in their fleets. The trouble with that, there was no wording in the language to have any of those vehicles on the road, so they were sitting in their parking lots. Long story short, we've gone down and down and down in terms of accessible taxis in this county. Now, we set up the TSIF with that particular emphasis at first. And the problem we've had is that we've had so many great ideas from the Department of Transportation on how the fund should be used. And we've had great ideas from my commission on how the fund should be used. And we've had great ideas from the county executives and county council members on how the fund should be used. And the trouble is, everything that we set up isn't appealing to the most important people to get information from, which is the drivers. The drivers are the ones who have to rent the vehicles if they want to put them on the road, or they have to buy the vehicles if they want to put them on the road. But the last person that is asked is the driver. And let me just point out some of the issues that the drivers have presented me with. And I hope that we will get further discussion from Mr. Ibick, who represents the drivers. One of the issues is when this fund was set up, there were ways suggested for buying or retrofitting vehicles for accessibility. Trouble is, it wasn't a full coverage of the cost, and it required the drivers or the owners of the disability taxi companies to pay the additional amount. And they couldn't afford to do that because many of them are immigrants and don't qualify for bank loans. So that attempt at first was a problem. And then there were per mile reimbursements advised for accessible taxi rides. One of the problems there is in order for the taxi drivers to prove that they have done this, is they have to get from the client their name, their address, all sorts of things that you don't have to get from a regular taxi ride. And understandably, some of the riders aren't able or willing to provide that information. So it leaves the driver high and dry. They can't access the reimbursement on that level. I really think that rather than going to try and figure out how else to use the money, what hasn't been done is that when DOT has been unable to use the money for its original purpose, it has been the easiest route, quite frankly, to say, well, we have this money, how else can we use it? I think that's the wrong approach, to say, let's put the money into what was suggested previously, a bus card or something else. What we really need to do is get the accessible vehicles on the road so that they can pick up people who have disabilities without having to have them wait 3 hours or 24 hours or 48 hours, which is often the case. And we need to figure out a way to make the program appealing to the drivers so they will, in fact, access the program and be able to put their vehicles on the road that are accessible. I'm sorry for that.
No, Dr. Morgan, that was incredibly helpful. That's exactly what I was hoping for, to provide the context and the history, especially from the advocate's perspective on where we are. And in a moment, we will hear from those drivers directly in the first person about some of their challenges. But Dr. Orland, I'm going to turn it over to you just to lay a little bit of context and further background. Dr. Morgan did a great job just now, but anything you'd like to add before turning over to the drivers to hear from their perspective? And then, of course, we want to hear from our colleagues in DOT, reactions, thoughts, reflections. Dr. Orland.
Thank you. I really don't have anything to add. Dr. Morgan gave a good summary. What we've done is put together this panel. Dr. Morgan's the lead on it, a lead person on, and there's 6 of them. And we've asked each to speak very specifically about what they would do to improve transportation for seniors and folks with disabilities. Dr. Morgan gave the background, but I think if we could turn right back to Dr. Morgan and see what his specific ideas are, and then go talk to the other 5 folks on the panel, Ms. Ellis, Mr. Ibick, Mr. Mahebi, Sean Brennan from DHHS and Sam Oji from DOT. And we asked them to keep their comments to like 5 minutes each, because this is not a long work session. And then basically this is provide input to you, the two committees, so that as you come into the operating budget, you can have some ideas in hand that you might want to implement, or at least can mull them over before you make a decision as what you're going to recommend. So with that, what I would ask is see if Dr. Morgan has any specific recommendations to do, and then move down the list of the other 5 speakers.
Sounds great.
Yeah, thank you. I again would just state that I think the drivers are the most important voice here, but let me say that what we have to do is make it much easier to access these funds for the drivers to be able to access them to get reimbursed. As I pointed out, it's hard to document trips frequently because the people getting the trips can't or won't permit the driver to share their information that is required to get the reimbursement. So what I would say is, I think the accessible vehicles should probably be bought outright, and to protect the county so that the vehicles are not moved out of county. Put a lien on them so that they cannot be moved out of county, but have to be used, and they have to be put on the road, not just sitting in a parking lot. And asking the drivers what is the system that they feel would best make it easy for them to access the program and the money. And it's not an easy answer. I think DOT has done an excellent job with the ideas it's come up with, but as the drivers tell me, it's still too unwieldy, and we have to figure out a way using the drivers' information on how else they feel it would be made easier for them. Ask them, what do you need us to do to make the money available to you in an easy fashion that still permits emphasis on accessible rides for people who need them in the county. And I'm sorry that's very non-specific, but we've given specific ideas and letters in the past, and clearly we don't have the answer either, because our ideas have not resulted in the drivers using it much more robustly. So I would, with that comment, pass it along to the next speaker.
Thank you so much, Dr. Morgan. Ms. Ellis, thank you so much for joining us. Of course, you are the chair of the Taxi Cab Services Commission. We appreciate your leadership. I'll yield to you, and the floor is yours.
Great, thank you so much. And thank you so much for inviting me to be on this panel. So I am the current chair of the Taxi Services Commission. I also served as chair to the predecessor to this commission from the years 1999 to 2005. So I bring a lot of experience with taxi services in the county. So before I make my comments, I just want to mention that my comments have not been formally reviewed by the commission, but they do reflect the work that we've done, plus my 30-some years of experience with paratransit and taxi services from my consulting practice. So the issue of wheelchair accessible vehicles, and I note that we refer to them in abbreviated fashion, we call them WAVES. It's very important, not only because of the ADA, but the county's requirements for accessible vehicles for the companies, and then now with the TSIF. It's also the right thing to do. So in 2021, our commission had several meetings developing and then submitting to the recommendations to the DOT director for the use of those TSIF revenues. And it's important to remember where they came from. They came from Uber and Lyft trips, which are the key cause of the problems for our taxi industry here in the county. It's useful to know those two companies, those two California-based companies, have been providing trips at rates that do not reflect their true cost because they've been heavily subsidized by venture capital. So it's not been a level playing field for our taxi companies and drivers. The revenues from those trips should be focused on our taxis. So regarding our recommendations, we group them into two categories. The first, to build a supply of WAVE service, and the second, to build demand. It's one thing to have additional WAVE vehicles, but they're not very useful if they don't have drivers. And of course, the drivers need business to stay in business, i.e. paying customers. And so that's the demand side.
So our recommendations for increasing the wave taxi supply, we have three, and in order of our ranking. The first, increase the subsidy to purchase a wave vehicle from the current $15,000 up to $30,000 with a not to exceed defined percentage of the purchase price. Getting a wave, and you'll hear from this from David Mohebe, is very expensive. If you can get a used minivan, and of course it's a crazy car market, it's about $35,000. It's another $14,000 for the conversion, plus taxes, licensing, etc. So getting a wave is up to $55,000 at a minimum. Our second recommendation to increase the supply is to increase the per mile payment for a wave taxi service from 10 cents up to 20 or 30 cents per mile. This is very important now with the increasing cost of gas. Our third recommendation is to increase the annual vehicle insurance incentive for a wave vehicle from the current $1,000 a year to $2,000 per year. So then on the demand side, we have two recommendations. First, increase the income limits for eligibility for the call and ride program so that more county residents can use call and ride, which of course are provided by our taxis. I'd suggest that the subsidy be increased for each of the current four categories of call and ride and for levels 2, 3, and 4. Currently, you have to really be quite poor to qualify for call and ride in Montgomery County, Maryland. And our second recommendation is to expand the eligibility for call and ride for people with low incomes. And I just wanted to make a couple of comments on the survey we did this fall. First, it's important to remember that people are more apt to complain than to provide praise or satisfaction. And second, the issue of the longer wait times. It's a direct correlation to the decreased supply of taxi drivers. And I've seen that in other jurisdictions. Currently doing a federal research project. We're looking in detail at TNCs and taxis in 5 jurisdictions across the country. The wait times are way up. And that's because there's not enough drivers. Thank you. And I'd be happy to answer any questions.
Thank you so much, Ms. Ellis. Next, we will hear from Mr. Peter Ebick, President of the Montgomery County Union Taxi Cooperative. Mr. Ebick. Mr. Ebick, can you hear us? I know that he was having some issues earlier. While we work that out, why don't we move on to the next speaker, and that is Mr. Mohebe, who is the president of Regency Taxi. Mr. Mohebe, thank you for joining us.
Good morning. Thank you, Council Member. I'm also president of Barwood Taxi, so Barwood and Regency. The main issue that Ms. Ellis mentioned, and by the way, I second her on everything that she suggested. She's very informed. I've been in taxi business since June of 1979, over 40 years. I've been involved with the commission and before that with TSAC. So all my life has been in the taxi business. The major issue we currently have is the capacity issue countywide. Just a few years ago, we were operating countywide over 700 taxis. 2 taxi companies went out of business, SunCab and Orange Taxi. And Barwood and Regency are at about 50% capacity compared to prior to the pandemic. Action Taxi is only operating at 25% capacity. So you can see from 700, we are down to about 200 taxi currently operating in the entire county, which is way below what is needed. The survey, which was recently came out, and I reviewed every question and answer on that survey. Some of the answers were outdated and out of touch. For example, a few mentioned that the prices of taxi rides has gone up. The last time we had an increase in the taxi rate was May of 2009, which was over 13 years ago. Back then, the minimum wage was $5.25, and that's gone up to $15, which is 3 times as much, while the taxi drivers haven't got a raise in 13 years. And so some of the reasons that a lot of taxi drivers left is because they can go get a job somewhere else and make $15 an hour at minimum wage, where driving taxi might not earn that much money. So we have focused our efforts, and our staff have been working around the clock to try to attract and add additional drivers to our fleet. We have managed to add 21 drivers in the last several months. In addition to that, we have purchased, even at this expensive market currently, we purchased 21 vehicles within the last 6 to 8 months. 11 of those were wheelchair accessible. In total, we spent over $750,000 in vehicles. We are operating currently 46 wheelchair accessible vehicles. None of those are sitting in the parking lot. Drivers prefer currently to drive wheelchair accessible vehicles versus sedans because they can have the additional income by the trips that they submit to the county and receive additional income from those. Plus, some of the wheelchair accessible trips have a higher minimum and they get paid more. So we currently have 100% of those 46 accessible vehicles out operating, which is way above the percentage requirement of the county, but we go by based, what the driver's income could be higher, and helping the drivers to maintain them in the fleet rather than them losing interest and leave. So we have gone out and signed many contracts with different centers trying to keep these vehicles busy so the drivers make enough money and keep them interested in the business and keeping them with us. So we've put all of our efforts into adding vehicles, adding new drivers, and maintaining what we've been doing for many years. But the pandemic, of course, hurt us a lot, and that's why we're currently at 50% operation compared to prior to the pandemic. For a year and a half, 2 years, the business went way below what it used to be. Now it started to come back, and we have to deal with the capacity issue and try to keep as many drivers as we can and add. In the meantime, the county DOT staff helped us tremendously during this time and expedited the driver hiring process and the paperwork, and that helped to make the turnaround fast, because these unemployed people who come and apply, they don't have the funds to sit around 2 weeks, 3 weeks, or 4 weeks to wait to get into the taxis. So we had to do kind of expedited process to get them in service. At the end, I just want to add that if you can do anything to use this fund to increase the drivers' income, because we need these drivers to be able to serve the citizens of this county. And if they don't make enough money, they will wander off and leave this business and go elsewhere. I had a couple of drivers just within the last couple months that left, and they're driving school bus. They're making $19.53 an hour, which they would never make that driving a cab. So you can see if we are in a compatible market in an inflation rate going up, the labor cost is going up, and unless we can think out of the box and manage to keep these drivers and help to increase their income, we will not have many drivers left in the next couple of years. I'll end it at here and see if you have any questions.
Thank you so much, Mr. Mohebi. I had the opportunity to meet with you a little over a year ago now, and I was just so impressed with how authentic and sincere you and your companies are in trying to meet the needs of our growingly diverse community, but especially those most vulnerable. So your thoughtful comments are noted and really appreciate them. Mr. Ebik, were we able to get you back online? Are you able to join us now?
Yes, can you hear me?
Yes, now we can.
Can you hear me now?
Yes.
Yeah, I've been having a
no problem. And just a quick
difficulties with
we have a
internet here.
We have a hard stop at 11:40, so we've got about 40 more minutes to get through the presentations and Q&A from colleagues. But Mr. Ebik, please go ahead.
Yes, yes, I appreciate. Thank you for having me, and thank everybody for letting me speak. But the taxi drivers, and this business, I've been in this business since 1998, driving nothing but wheelchair accessible. So I know the all in and outs of wheelchair accessible services. And I actually drove at one point with David Mohidi in a Regency. And I drove with Bow. I started with Bow. I drove with Action. I drove with Suncap. So I know about this. And then I've heard what Mr. Mohidi, I'm not trying to challenge anybody right here because we're trying to look for a solution. But there are a lot of things that Mr. Mohidi said that is not true. I'm sorry, I have to say that, but it is. Drivers do have issues, and then many of them stem out from the DOT also. The regulations against the drivers. As a matter of fact, I've just had one to send 2 of my drivers every week to the circle at the executive building for the inspector to come down and look at the
Mr. Ebek, I'm so sorry.
take another reading, and that's it.
Mr. Ebek, your audio is going in and out. I don't know why. You're cutting off during some of your
Maybe I should maybe I should do the phone call. Can I get the phone? Can I get it on the phone?
Yes. What we can do is, I believe we have your contact information. Our IT department can follow up with you and give you the call-in information so that you can do it by phone. I'm so sorry.
Yeah, let me do it by phone now.
Okay. Then why don't we move on then? And we're next going to hear from Sean Brennan from our aging and actually we do have, I'm sorry, Mr. Kassian, thank you so much for joining us as well. If you wanted to speak now, please do so.
Sure. President Albornoz, thank you so much for having me today. Yeah, I think David Mohedi kind of explained the whole situation of the taxi industry. Whatever I have to add in, there are 10 vehicles coming in based on the grant that was awarded to our company. So we have 10 accessible vehicles that are going to be delivered in Q2 to our business. This is the order that was placed a year and a half ago and was canceled by the manufacturer. So we cross our fingers to receive these vehicles in Q2. So we're going to add another 10 vehicles to our fleet, which are accessible, and increase our capacity to serve really the community needs. That was all that I have to say. Thank you so much, President Albornoz.
Thank you so much. And I'm hoping Mr. Ebek is able to join us soon. But while we're waiting to fix the technical issues, I'd like to next hear from Sean Brennan, representing DOT. And I know that, representing DHHS, who she's worked on these issues for a number of years. And Sean, just wanted to give you an opportunity to share your thoughts and reflections on the conversation thus far before turning it over to DOT. Ms. Brennan.
Thank you. Yeah, I mean, I appreciate this chance to weigh in. I think we all agree that riders should have access to high quality, reliable, and accessible transportation provided on demand as needed, especially for medical purposes. And I think we have agreement there probably is not one single transportation solution. And this is because resident needs are varied, costs are real and substantial in many cases, and there can be downsides to almost every option that we have for transportation. Cost, quality, who is served, how accessible and flexible the transportation options are. And frankly, based on their experience, some residents write off certain options. They may give up on metro access, for example, or refuse to try taxis anymore. And their decisions are not irrational. So I think it is important to think about investing in a variety of programs so that these various needs can be met. And I will add that just as people have a right to this kind of transportation, the people providing this transportation should make a living wage. And so this issue of how the drivers make their income, I think, is important. And there's something to be said for thinking about models that provide salaries. So in terms of some of the recommendations, it's encouraging to hear how many people are saying that we should expand eligibility for call and ride. It is a way to support the taxi industry. It does provide on-demand transportation that's very important. And now that the taxi cab regulation unit is run by the same person who's running Medicaid transportation and call and ride, and the county does regulate taxis where we do not have any power to regulate the transportation network companies, I think there's a lot of hope in expanding call and ride and working through our Department of Transportation to make this very robust. I would make the case that we can't completely rely on the taxi industries, and that funds should be available to volunteer and non-taxi transportation companies who can perhaps provide people salaries when they provide paid drivers, so that they too have access to wheelchair accessible vehicles. I liked Mr. Glass's idea of potentially partnering with medical adult daycare centers and such organizations that have fleets of wheelchair accessible buses, and seeing if there are creative ways that they could get engaged in providing transportation, whether it's to medical appointments or other important places for people with disabilities to go, and people who need expertise in working with folks with medical conditions. I think sometimes we put people on our head, they're either ambulatory or they use a wheelchair, and that's the end of it. And one of the things the taxi cab survey showed is people have all kinds of different needs. Some people have a very hard time getting in one type of vehicle or another. They could have balance problems. They could fear of falling. They could have mental health problems. So having people who are specifically trained to deal with individuals who have a variety of different health conditions, you know, it's just important that we have that as an option for the people who need it. I think we should consider a grant program for medical providers who might want to embark on transportation services to their facilities. And another idea is to think about supplementing the Connect a Ride program that Jewish Council for the Aging runs. It's a mobility management program that provides information and referral and assistance with applying for a variety of programs. We could bump that out a bit so that there's a little bit more hand-holding and perhaps even some supplemental funds provided to Connect a Ride to help fill the gaps that they see people are facing. You know, when times are really tough. For example, someone is newly needing dialysis and they are struggling to figure out how they're going to get there 3 times a week. There may be a great program. Maybe they're trying to apply for Medicaid transportation, whatever. It might be nice for them to have some resources available to them to fill gaps. So I think that's it with one final idea, which is sometimes the problem that we have is really a problem of inaccessible housing. People cannot use metro access or accessible wheelchairs because they need people to help them get out of their home and to the curbside. So sometimes we end up paying very expensive transportation solutions to get folks to where they need to go who are living in an environment that is not truly accessible to them. So we might want to think about helping people either make changes to their home so that they're accessible or find other housing. And in the long run, we may save a lot of money versus paying for multiple people to carry someone downstairs, for example. Thank you.
Thank you, Ms. Brennan. Those are excellent recommendations. And yes, our office has been especially engaged with the adult medical day providers, as Council Vice President Glass noted, and they do an outstanding job and extend our reach and provide real multicultural services that are outstanding in multiple languages, which is terrific. Mr. Ebick, I see that you have called in, and so I'll give the floor to you for the next 45 minutes to make comments, and then we're going to get to the Q&A after hearing from DOT. Mr. Ebick. If you can unmute yourself, Mr. Ebick, and then you will have the floor. Mr. Ebick, can you unmute yourself, or can the team unmute Mr. Ebick?
I believe he will need to hit *6 to unmute.
Okay, Mr. Ebick, if you hit *6, you will be able to.
Can you hear me now?
Yes, now we can hear you.
Okay, all right. Man, I'm playing with the computer and then the phone. Okay. So I thank you again, gentlemen, Councilman Albernos. I thank you for letting me in, and I thank every man.
Mr. Ebick, if you can turn off your computer and just
hold on.
Yeah, close the computer.
Okay.
Peter.
Can I come in now?
Yes.
Because I was having bad echo. Yeah, all right. I'm sorry about that. Yes. The problem with the industry is mostly lack of drivers and issues with regulations. But let me just cut it short because I wasted a lot of your time this morning. So I do have some suggestions on how to get drivers back, because the drivers do want to come back. Those that went to overlift, they are not happy with them. They want to come back. But their fear is the regulations and the cost of getting back into the system. Now, first off, with the PVLs, there are so many PVLs out there on the street that, in people's hands that are not on the road. We need to recover those PVLs and then have them, make them available to people who need to get, work with them. So I have, excuse me, a suggestion that drivers do want to own their own vehicles, which is more reasonable for them instead of driving and paying somebody on a daily basis and weekly or, whatever you may have it. But they need to have their own vehicles. At any time taxi, that's our model. These vehicles, we have them leased to own, and then they are happy with it. But we don't have that many because we don't have the money to buy any more than we have bought. But drivers do need PVLs to buy their own. So if the county can issue, say some like first 50, 100 drivers that come in for application to have a wheelchair accessible van, issue them a free PVL at least for the year. Let them not pay that expensive initial payment to get it. And then for those who have theirs to renew or renew their PVS, just renew the PVS free for 1 year. That will bring a lot of drivers back in. The next suggestion I have is having wheelchair accessibles and sedan drivers. Some people cannot drive wheelchair accessible, so it will be a change of career for them. So they need to be trained, thoroughly trained to do that. And then all cab companies can participate in doing that. We are doing that already, training them more than just drive, how to drive. They already have license to drive. All we have to train them how to provide the service. So we do that. Or right now, we train them, let them know about ADA's regulations and everything they need to know to provide this service to disabled people. We do that. So the next suggestion I have is about releasing companies. Some drivers left because they owe money. They could not pay. And there are a lot of them who are afraid to come back because when they come back, they'll get charged for the money they owe in the past. So I'm suggesting that maybe from the TSI funds, the companies, it's only 3 companies now, but Regency, Action, and Anytime Taxi. And if they can get, say, $50,000 each to forgive all the drivers who owe them and absorb the drivers back in, it will help bring the drivers back. And the county, I've had Sam and used to, say that about advertising the opportunity, whatever the program that is available in the county and the providers, it will also help. We are doing some ourselves, going to the nursing homes and rehab centers and advertising, giving them our brochures and let them know who we are and what we do. We do have many calls from them too. We need to revisit Chapter 53. Sometime, not right now, but sometime in the future, because a lot of things are there against drivers that take them off their work to report about something that is not even necessary. Say, for instance, just recently, which is still happening now, I've been called several times to send 2 drivers each week to the 101 Executive Building Circle so the inspector can come down and take their odometer reading, and that's it. So, you tell drivers that, they rather, just leave the car and walk, because that's very unnecessary. But I did speak with the inspector, and then he told me it's somebody from, the licensing manager, all about spending this TSI fund. You want to make sure that the mileage is exact, is what the drivers claim. I don't know. But these kind of things have to stop. Those are the kind of things that little things like that turn the drivers off. They just leave.
Mr. Ebick, thank you so much. Those are incredible suggestions, very helpful. Good segue to Mr. Oji and Mr. Conklin on behalf of DOT. Just reflections, thoughts, and some of what you've heard thus far. And if you can make an abbreviated version of that, I'd appreciate it so we can get to some of the Q&A from colleagues. But Mr. Oji or Mr. Conklin?
Thank you, Council President. DOT does understand the criticism surrounding the underutilization of the TSIF. We've heard it, over the years. The department's goal for this TSIF is twofold. Obviously, the first is to work towards improving transportation services for individuals with disabilities, older adults, and low-income residents. And the second will be, obviously, to offset the cost of operating wheelchair-accessible vehicles in the county while helping the cab companies continue to provide this much needed service for county residents. In 2019, the department realized that the initial regulation guiding the use of the funds did not go far enough. And a new regulation was established at that point, which switched, for instance, the reimbursement for wheelchair accessible vehicles purchase or retrofit from 4-year disbursement to a lump sum payment upfront for $15,000. We also increased the flat fee that drivers receive for providing wheelchair accessible trips from $10 to $15 for day trips and to $20 for night trips. We also added a component which will reimburse $1,000 to wheelchair accessible vehicle operators towards the cost of their insurance. And the department's plan was to continue to enhance this program by adding other components that we feel will help us achieve the intended purpose of this fund. Unfortunately, we encountered the pandemic. There were delays in implementing some of the ideas that we've discussed. Now, fast forward to summer of 2021, the department decided to engage the stakeholders, engage these groups that represent the intended recipients or the beneficiaries of this fund. To that effect, we engaged with the Commission on People with Disabilities, Commission on Aging, had talks with the Commission on Health, Montgomery County, Montgomery Cares Advisory Board, Taxi Cab Services Commission, soliciting feedback and recommendation on ways to use the fund. And I'd like to thank those groups and because they were able to provide some valuable suggestions and recommendations, which a lot of them have been listed here today as well. So through the holidays, the department has worked on these recommendations, identifying costs, analyzing and preparing implementation plans for these recommendations. And I can just list a few of the ones that we are advancing to implement as soon as possible. The mileage, which is 10 cents a mile, we're looking to increase that to about 25 cents a mile. We're also looking to implement, in partnership with Montgomery College, passenger assistance safety and sensitivity training program. This is something that comes up from the Community Transportation Association of Americans curriculum. We will partner with them to train drivers on approaches to providing service, both wheelchair accessible and customer service itself. And the county, through this fund, will be able to reimburse certified trainers from Montgomery College to provide this training to our taxi cab drivers. And at the end of the training, they all receive a certification. The drivers will receive a stipend for the time that they will be there for the training, as opposed to being out generating revenue. We will also increase the reimbursement for retrofit and purchase of wheelchair accessible vehicles. We're tossing around what that number will be, but we do want to increase that. And maybe the outcome of this discussion would lead to a number that we will increase that to. The income eligibility for call and ride, we've heard from several people here today. We totally agree that it should be, we should address that, whether the age now for older adults, which is 65, we want to reduce that. The income itself, we already expanded in fiscal year 21. We will also go ahead and expand that again. This will give more residents an opportunity to participate in the program and, of course, provide more trips for the cab companies in the county. But the one that I feel like we understanding that over the years, the fund, the focus has mainly been on the taxi cab industry. We want to be able to provide grants to nonprofits that provide transportation services for older adults and people with disabilities and low-income residents. So when you're talking about, all of the organizations, volunteer organizations, help organizations, nonprofits will be able to apply to Montgomery County Department of Transportation annually, and through this fund, they will be able to use them, whether it's for personnel costs, capital costs associated with purchase of vehicles, administrative costs, insurance, anything that any expenditure that they encounter of providing these services to older adults and people with disabilities. We also will partner with Public Health Services on an annual grant. Dr. Rogers and Dr. Odile Brunet earlier on today did mention the issues that they have about transportation. We've been in discussions with them, and we agree that since the population they serve are also part of who this fund is intended to serve, we will partner with them to provide those transportation services much needed for these services that they provide. Additionally, we will also allow other county departments who have services or programs that they provide to older adults and people with disability to tap into Montgomery County Department of Transportation vendor services, transportation vendors. So this could be either HHS for their crisis center, they need a transportation for one of their clients, they can contact one of our vendors and they'll provide transportation when needed for that service. Or any other department, HOC, their housing, DHC, anybody within the county that's a county department of aid or agency will be able to utilize our vendors, and they will be reimbursed through this fund as long as it's for the population for whom the program is intended for. So
Sam, I can tell the council president is getting anxious to make space for his colleagues.
I will yield now. Okay, I can provide more details about what we're working through with regards to these recommendations. They're all valuable. We hear you, and we will do our best to continue to engage and keep the dialogue open with all the groups so that we can meet the goal of this.
The council president will formalize recommendations as we continue to go through the input from this session and the previous input we got from working with these groups over the fall. And with that, we'll end our comments.
No, thank you so much, Mr. Conklin and Mr. Oji. And I know that we've been working on this for quite some time. I'm hoping that at least some of the recommendations will be reflected in the county executive's recommended budget that comes over in just a few weeks. And we, of course, stand ready to work with you all on all of this as we have and continue to feel how important this is. I'll turn it over to Chairman Hucker for questions and thoughts, and then Councilmember Reamer. Chairman Hucker, and just again, a quick note, I apologize, everyone. We have a hard stop at 11:40 because we need to access this technology for another meeting. But Chairman Hucker, I turn it over to you.
Thank you, Mr. Chairman. Mr. Oji, listen, what I'm about to say, I don't think is directed at you at all, but I think if we played your comments again, they would seem very, very similar to what I know you said in front of our committee a year ago and a year before that and probably a year before that. I hope we can just agree that this is Montgomery County, Maryland in 2022, and we should never hear from residents with disabilities that it takes them 48 hours to get access to a taxi to drive them to a doctor's appointment. I mean, that is insane. All kinds of countries do much better than Montgomery County, Maryland, and that is by choice. It's not inevitable. It's not about reimbursement. I keep hearing we're increasing the reimbursement for driver. I've been here a year ago and 2 years ago and 3 years ago, and we heard from drivers firsthand, including Peter Ibeck, who we need to provide some support for so his important voice can be heard by this committee yet again, the joint committee and the full council yet again. But drivers who apply for an increased reimbursement and don't get reimbursed by our county for a year or longer, it doesn't matter how high the reimbursement is if we never pay them back. These are people who are having trouble paying their rent and paying their electric bill and feeding their families. And we can say we changed something from $10 to $15, but if they never see the increase $5, they're not going to work for us because we're not a trusted partner. We're just exploiting them, taking advantage of their labor. And other jurisdictions don't do that. So, you know, I've heard this over and over and over in the Transportation Environment Committee. I know that former Chairman Berliner and Councilmember Florine, if they were here, they would be pounding the table to say, why in the world aren't you executing the instructions that this council gave you, DOT, years ago, I mean, in 2017, 2018, 2019, 2020, to set up a system that gets more drivers on the road and gets accessible vehicles on the road. This is not complicated. We can't do it. We've expressed our values. We've told you what the policy is. We can't do it by ourselves. But that's the policy of Montgomery County. And 6 years in now, it's not being executed. So I don't know what else to do. It's very frustrating to me, but I know I don't have to, you know, wait for a taxi to show up for 48 hours. Our residents with disabilities do, as we heard from Dr. Seth Morgan earlier. It's just very frustrating to have this discussion year after year after year because it feels like we're not moving ahead. And we keep hearing assurances, like I read Mr. Madalino's letter in Circle 3 that he agrees with us and they're going to do more outreach to stakeholders. We don't need agreement and we don't need outreach to stakeholders. All the stakeholders have been in work session after work session after work session. We're just not actually executing on the policy of the county as expressed by the previous council and this current council. So that's the problem to me as the chair of the committee and the longest serving member of the Transportation and Environment Committee. I've just been hearing this over and over, and I keep hearing heads nodding in agreement, but then nothing happening. And if you talk to our residents facing disabilities represented by Mr. Morgan, Dr. Morgan, and if you talk to our taxi drivers represented by Peter and so many others, Mr. Ivick, you just hear constant frustration. And this is not, we have many difficult problems to solve. This is not a difficult problem. So I just hope, you know, we can move forward with new, I don't know, commitment to this. And Dr. Orland, I hope we can hear from you your recommendations on how we can actually use the operating budget once again to force the administration to make the investments to protect our residents with disabilities and our drivers. Thank you so much, Mr. Chairman.
Well, thank you, Mr. Chair. I did actually, well, before we get to Dr. Orland and his response on his reflections and thoughts on next steps, I do want to hear from Councilmember Reamer and then Council Vice President Glass. Councilmember Reamer.
Thank you. Well, you know, I generally think we've got to view services particularly for our more vulnerable populations as an essential public service. And we have been able to rely upon the taxi sector imperfectly over the years to just do that almost as a regulated private service. But we just have to step up and do more to ensure this access. And I would like to know what the models are. And I think that's what you're working toward, but I just think that we've got to move faster here. I would like to see the county issue an RFP, you know, based on a certain service level goal. I mean, maybe we should be the ones to buy all of the vehicles and then lease them to the drivers. I don't know.
We should.
The answers are, but I just think we've got to step up our effort and you know, I mean, that's my general point here. The delay of delivery of wheelchair access vehicles is incredibly frustrating, and I know that could be beyond any control. At the same time, you know, there are other ways that we can provide support. So I just think this needs to be at the forefront of our transportation policy thinking. You know, we have to put our best minds on this and say, what is the future of this sector and how can we continue to provide, or how can we once again provide adequate levels of service. So I appreciate Miss Ellis's comments. You know, I thought that she was making a lot of the kinds of observations that are certainly going through my head. But, you know, I think some of the things we haven't heard are like, how many vehicles do we think it would take? You know, how many calls do we receive? And is there, you know, is technology, are app-based systems inherently closed to many riders with disabilities, or can we continue, you know, can we use them? You know, do we need to have a phone call system? Like all of these things, just you know, we've got to get to a coherent strategy. I know it's not easy, but could we RFP? You know, we've got $3 million in the fund. You know, how much would it take to RFP a certain kind of service? So those are some of the comments that are going through my mind. I don't have answers. You know, I don't know that anybody here has answers, but we know we need to press forward and do more. Thanks.
Thank you, Councilmember Reamer. Council Vice President Glass.
Thank you, Mr. President. I appreciate all the comments by everybody here, sharing your perspectives on what we are doing right, but more noticeably, what we need to be doing better. Again, I appreciate the framing of this entire work session, because to have this much money on the table and not utilize it, it's a shame. We need, these funds were collected for a purpose, and clearly the fact that they are not being dispersed shows that we are not fulfilling that purpose and our pledge to various sectors, residents, industries here in Montgomery County. And we got to do better. And because of the disruptive nature of at least the taxi and mobile app industry, I think we just need to be creative and drilling down on what we have been doing. Aside from not dispersing the money, I'm not quite sure is the way to move forward. So I know that we'll have subsequent conversations, and as was alluded to, maybe we'll pick this back up back in the budget and be a little more direct about how to disperse these funds. But let's get creative. There's a need, and it's not being met, and we have funds to do something big, imaginative, creative that helps our residents who most need it. And I look forward to working with all of you over the next few months or beyond that to fulfill that obligation. So I look forward to the conversation, and I yield back, Mr. President.
Well, thank you all. Let me just connect a couple of dots, make a couple of points, and then ask Dr. Orlin a question. So obviously all of us are feeling tremendous urgency, and I very much agree with the comments made by all of my colleagues, particularly transitioning this to an essential service and thinking about it in that way. It's a paradigm shift, but this is absolutely in the public's interest, to make sure that especially our vulnerable populations, particularly our community for people with disabilities, have the kind of access that they need to be able to access these medical appointments, just as we gave as an example of why this is a public health issue, every bit as much as it is a quality of life issue. So I know that this has been an ongoing discussion for numerous years now, and I really appreciate the chairman's frustration. And although I'm newer to this issue, it's clear from everyone involved that we are not meeting the needs of our community in the way that we need to. So there were some great recommendations, both directly from a policy perspective, but also from a budgetary perspective, that I think are really important for the council to follow up on. Dr. Orlin, I know you were taking copious notes, and obviously all these sessions are recorded, but I know you'll put together a report summarizing, these thoughts and reflections and recommendations, but just want to give you the floor now from your perspective on what you think from a staffing and administrative standpoint the next step should be for the council, and then we can follow up from there.
Yeah, I'll be really brief because a lot of this information is new to me as well, and really good. I agree with you. It's really good ideas out there. A couple things. First of all, I'm hoping, just as you mentioned, earlier, Mr. Alvarez, that maybe not all, but most of these recommendations that particularly Mr. Oji mentioned will appear in the March 15th budget. So we actually have a cost by it. We have specifics and something to really chew on. And if it's not ready by March 15th, oftentimes the executive sends over revised portions of the budget maybe a few weeks later. As long as it gets here during the operating budget season, that would be very, very useful. Secondly, I think the idea of actually trying to reach out in grants to nonprofits for better use of the waves that they have is probably a quicker way of getting them on the street, because we've all heard about the supply chain problems. We could have all the money in the world, and you heard from Mr. Mohebi about how long it's taken to get the wheelchair vehicles, accessible vehicles that they've ordered, and they actually had an order that was canceled, as was what I heard at one point by the manufacturer. So it's not something that's going to be instantly solved, unless it won't be instantly solved anyway, but it could be mitigated by reaching out to the nonprofits. And then finally, what I'd say is this: yes, we have a lot of money in the fund, but we have to be sure about the sustainability of that fund. We can't spend it all down in 1 year, because then what happens after that, particularly if you have in the programs that we're talking about continuing costs that are higher. And so these are all things that are sort of running through my head, and I'll be following up with on some of these issues with some of the individuals we talked to today, and also with the department, and be talking with you privately, but also when we get around to the package, the operating budget, with some specific recommendations. But thank you.
Thank you so much. And we look forward to our partnership with the executive branch on enacting the recommendations. We know this has been a priority for DOT, and it's certainly a priority for this council. So thank you all so much for a very productive session. We look forward to the follow-up. The proof will be in the pudding, and we all understand the urgency from which we have to move forward. So thank you all very much. With that, this briefing is adjourned.
Thank you all.